Hi. So this video is about how to navigate if your nipples are being injured due to a poor latch. Now the poor latch, don't take it personally and don't put it on yourself as a mom. A latch can be difficult to nail down in the first few days. It takes a while for you guys to figure each other out, but if your nipples are still being injured approximately about 2 weeks after baby has arrived or later, then it's possible what's happened is that baby has learned an incorrect latch and is continuing to use that. In the first couple of days, you and baby are trying to figure each other out. So yeah, your nipples can get a little bit sore just because baby knows what they're doing but hasn't practiced enough to try or to quite get it right yet. Ongoing problems suggest that baby may have started latching and developed some bad habits. So here's how we can course correct, or here's how to set you up for success from the very beginning if you've just had your baby. So we don't need to lock baby into place. We don't have to position them and do this and show them how to latch. If you've been told that, that was actually incorrect information. Look at any other mammal on the face of this planet. It doesn't matter if it was a giraffe. It doesn't matter if it was, a baby cow, you name it. Mammals, when they're born, know how to get to the breast and they know how to latch. Humans are no exception. So your baby actually can do something called the breast crawl when they arrive in the world. When they show up, if placed on mom's abdomen, they will use little froggy legs, pushing themselves up to the breast. They'll start rooting around and they will actually latch and start to eat. If not interfered with, they know what they're doing. They just need opportunity to practice, and that's generally what we're doing in the first few days together, is just figuring out, how do I hold you in a position that supports you being able to make use of your natural reflexes. So we're going to take all this idea of I have to show baby what to do, crumple it up, throw it out the window, and instead think, how do I support my baby being able to practice what they already know how to do? And here's how you can do that. First of all, make sure the baby's nose is in line with their navel, so nose to belly button. If babies have to rotate their head to the side to be able to eat, it's more difficult. It just sort of messes with the alignment of the tubes in their throat. So it's not impossible, it's less comfortable. So making it as comfortable as possible, have their nose lined up with their belly button. Next thing, have baby's face facing directly towards the nipple. Women, we come in so many different designs, so your nipples might be facing up, down, out, who knows. Wherever they're pointing, it doesn't matter. Just get baby's face angled directly towards the nipple. Next thing, you're going to take the tip of the nipple and you're going to tickle the underside of baby's nose. What that's going to cause them to do is, first of all, be stimulated and realize that the breast is there, but also to lift their chin, open their mouth, and clamp on. This is going to achieve two important things for you by touching the nipple to the underside of the nose. First, by lifting their head like that, they're going to have a small portion of the breast in the top part of their mouth and a larger portion of the breast in the lower part of their mouth. Why this is so important is because they're not just suctioning milk out of the body, they are pushing milk out of the body with their tongue. This is actually one of the reasons why a breast pump, at least the designs on the market now, are never going to be as good as your baby's natural nursing response, because none of the pumps have figured out how to mimic this motion from underneath. So very cool that your baby is both suctioning and pushing milk out at the same time. By tilting their head up like that, it makes sure that the nipple isn't just equally in their mouth, but instead that it's up here and their tongue is able to do its job. So tilting the head up by placing the nipple here, okay, you're going to get that proper nipple placement. And the other thing that you're going to get is something called a head tilt chin lift that allows them to both breathe more easily and to eat more easily. So with an open airway and the trachea and the esophagus just nice and wide open, able to do their jobs, it means that baby's not going to be wrestling and fighting and trying to make themselves more comfortable. They're in the most comfortable position possible and they can just focus on the job of eating. So last couple of things to keep in mind with your baby. As you are holding them, okay, you don't have to lock them into place. Allow them that space to move. And just if you need to unhook them, please don't pull or pop baby off. That's a really good way to give yourself nipple hickeys, essentially. Internal bruising. You can end up with blood blisters on the inside of the nipple, which really freaking hurt. Don't do that to yourself. Don't pull off or pop off baby. Break the seal, and breaking the seal means that you're simply taking your thumb or a finger, hooking it in the corner of their mouth and pulling, or you can use their cheek and just do a gentle pinch because it pulls the side of the mouth out either way. As long as the seal was broken so air was able to get in, it causes them to just let go of the nipple rather than and pop off. So nipple injuries can also just come from how we were taking them off. Breaking the seal will make your life so much easier. So know that if your nipples have taken a little bit of a beating already, it's going to take a bit of time to heal from. It's going to take a couple of days. There's a couple of tricks on the internet you can take a look at, what can you put on that is going to be comfortable for your nipple and also, is okay if baby gets a little bit of it in their mouth while they're breastfeeding, if there was a little bit of residue on you. But one of the most simple tricks is actually your own breast milk. It has a ton of things in it that encourage healing. So when you're done breastfeeding, you can even just squeeze out a little bit, rub it around so that's sitting on the nipple and let it dry on there. And that will speed the healing process as well. So just know that if you got some nipple injuries in the first couple of days, that's normal. It doesn't mean you're doing anything wrong. It just means that you're learning. Even if you've had 10 babies before this, every baby is different. This one is learning how to eat, and you're learning how this one interacts with your body. So just love your sweet self, love your baby, know that you're figuring each other out and it's going to be okay. So I hope that video was helpful for you. All the best.